So glad we're doing this topic with Dr. Henstrom from Utah Facial Plastics. Welcome back to the show. Body dysmorphia disorder. Now, at the beginning of the show, we talked about social media and how that Utah teacher says so many teens are on it way too much. Parents, we don't know what they're looking at. Can it create this disorder? Dr. Henstrom, you say yes, for teens and for adults.
Yeah, it can. So it's not unusual, and we all take a look at ourselves and we see things that we want to fix or change. But body dysmorphic disorder takes it to a different level. When it affects your mental health, when it affects your daily routines to such a point that you negate going places or doing things with people because you're fixated on small things, then it becomes a real psychological issue that people are having, and it's a problem, and it's increasing.
It is increasing. I feel like you see it all the time. I mean, you hear celebrities talking about it. As a physician, when people come in to see you, how do you know if they're just looking to fix something or if they have body dysmorphia disorder?
Yeah, that's a great question. So one of the most important questions that we ask patients when they come in is, why are you here? Why is it that you want to change this? Can you explain to me why it is? And many people have great reasons. They've been thinking about protruding ears that they've not liked for a long time and they want to change it. However, when patients have reasons of, well, you know, I've been looking at these pictures and I'm comparing, they bust out their phones for us and they say, I'm comparing myself to these people and this is what I want to look like, or, you know, they have other reasons. I had a patient recently come in and started to describe to me how her now ex-husband was comparing her to his ex-wife and how that influenced her to go to social media to look at this person, and the reasons behind desiring to change aren't healthy.
I think it's fascinating too because sometimes it's not just pictures, it's the filter. I saw myself with the perfectly perfect Snapchat filter, and now can you make me look like that? Do you hear that sometimes?
Absolutely, absolutely. We see it, whether the patient admits it or not, that's truly what they're looking at. We've got some filter pictures here, and you can see what they do. They make the eyes unusually large, they make the lips unusually large, and patients will come in and say, you know, I like this look, and I'd say, great, this is a fake look. Nobody looks like this. This isn't real. This isn't healthy. And there's actually something that we've blogged about recently on our website called Snapchat dysmorphia, because of these filters that people are using. You know, a recent study showed that just selfies and using some of these filters makes a nose look 30% bigger than it really is.
I read that you, in some of the facts that you said, I can't believe that 30% bigger. If you take a selfie, your nose looks bigger.
So then a patient comes in and says,
I look awful.
Well, it's not always that it happens, but it happens enough, and it's a big enough change. They come in saying, well, we want my nose smaller. They want something changed. And when we evaluate it, we say it's really appropriate for what your face is. And so one of the things a good physician in our position will learn to do is to tell some patients, no, you don't need this. That patient I referred to you earlier, we had a wonderful discussion. I helped her see the fact that she was beautiful. She didn't need anything. She was wanting to get something done for some other people and other reasons. She didn't need anything. And she came out of that much better off than if I could have done anything for her.
All right, for our viewers out there with teenagers and maybe they're struggling with themselves, what should they do? What can they do?
Well, I mean, I think the discussion you had at the beginning of the show was very appropriate. There should be a limitation on social media use, and if it's gotten to such a point where it's really affecting their livelihood, you know, professional help needs to be sought. Having that discussion, I think the most important thing that teacher did down there in Pleasant Grove was started a discussion amongst the students, amongst the youth, so that they can all realize that no, this isn't real. What we're seeing isn't right. This isn't what we want to be about. And so just having that discussion with your children is really important so that they realize these are not real images. Let's have a healthy concept. Let's not look for this toxic perfectionism that's kind of gripping some areas of our country and some areas of our lives, and let's let go of that and really accept who we are and change what we can.
Well, it's refreshing that a physician, a facial plastic surgeon will say no and have this conversation if they feel like that you really don't need it.
Well, it's a standard you can't reach. There is no perfectly perfect.
That's exactly right. We shouldn't search for that or seek for that, and we need to be the best version of ourselves, looking to improve ourselves, but not in comparison to others.
I love it. Dr. Henstrom from UtahFacialPlastics.com. There's the phone number. Go see any of the amazing staff. You and Dr. Thompson are so wonderful. They call him Henny, which I also love. Dr. Henstrom.
By the way, it's great to be here on my 1-year anniversary with the practice.
Congratulations. You're a wonderful addition.
Thank you.
All right, Allie.